Steve, you got the most votes.
Excuse me?
Steve, you got the most votes. What do you think Mr. Millen should do at this point?
First of all, I'm obviously pleased that I got the most votes. Obviously, Scott Millen has to decide what is best and how he wants to proceed. So we'll let him make those judgments. It was a very close election. We all know that. I'm excited about continuing to serve Vermont, and I'm really focused now on doing what governors have to do, which is addressing the challenges that we're facing. And if there was any message in this election, it is clear that we're facing a lot of them, and we've got a lot of work to do. So I've been reaching out to folks from all parties, Republicans, Democrats, Independents, Progressives, and none of the above, to get their ideas, to listen, and to obviously chart course forward that's going to address the tremendous challenges that Vermont faces. So I got my piece of paper. The only thing I was going to let you know, since some of them are in the room, is I have 3 extraordinarily dedicated folks who have been reassigned within my administration. Sue Allen is going to become my Secretary of Civil and Military Affairs. Allie Richards will be the Deputy Chief of Staff and Director of Intergovernmental Affairs. And Scott Coriel will be the Deputy Chief of Staff for Press Relations and Communications. So those are 3 changes I wanted you to know about. They're all 3 incredibly dedicated to the state. I'd be lost without them, and I'm pleased with their new assignments. I was supposed to come first, but I couldn't find a piece of paper.
What's behind the changes, Governor?
Just really internally, we asked a simple question going into the next legislative session: who is best able to do the jobs, these responsibilities? Some folks want to change. As you know, Sue's been doing the press job for a long time. She was ready for a new role, so she'll be helping to lead the legislative efforts in the legislature this year, which is one of the jobs of the Secretary of Civil and Military Affairs, as well as obviously overseeing our National Guard and military.
The briefing this afternoon by Lawrence Miller, are we still planning to relaunch the website this weekend?
We are. We expect it to be up on Saturday. I've been told that we're on track, so I'm optimistic that it's going to do exactly what we hoped it would do when we took it down to work on it. The first is any security challenges have been upgraded and dealt with, and secondly, that the functionality of the website will be more user-friendly. And we're optimistic that it will be up and running. I know Lawrence is going to do a briefing. Is it later today? 2 o'clock today, and he can tell you exactly where they're at. But I'm encouraged by what I'm hearing.
Businesses up to 100 employees now would be mandated to sign up through the exchange. That obviously is that going to work now, or is that still something that's going to be in advance for a while?
So my understanding is that doesn't actually kick in until when is it, 100?
And we've also had SHOP go through the carriers for
right. Right. But when does it change to 100 employees?
2016.
Is it 2016?
I'll check.
Yeah. Anyway, I don't believe that it's this year. The 100 change is particularly required by federal law happens in another year. Having said that, in terms of the businesses, they're going to continue to purchase their insurance for this re-enrollment period through their carriers, Blue Cross Blue Shield, and BP. And that's been the intention all along. That's not going to be this.
Governor, you haven't really used the word single payer since in the last week. Are you afraid of talking about single payer at this point? Are you committed to single payer? Will you say single payer?
Single payer.
Are you committed to single payer? Are we going forward with agreement on care?
So I've been committed to single payer all of my public life. And you know that I believe that one of the big challenges that we're facing as a state is affordability, cost, and access to health care. So I believe, and this is no secret, that if we can move to a system that spends less money for better outcomes and that ensures everybody, based on their residency, the state of Vermont, not because of where they work or how lucky they might be, that we'd have a much better healthcare system, more affordable healthcare system. So I think there might have been, in fairness to me, what I've said is, in light of this election, obviously, I am doing exactly what I believe Vermonters are asking me to do, which is to listen to folks, to talk to folks, to reflect, and also to really be more inclusive in everything that we're doing. And that's what I'm trying to do. But to attribute those goals to any one particular issue is not my intention. If I'm not communicating that clearly, I should. I believe that moving Vermont to a single-payer healthcare system will save us money, will make us a better state, and will improve the affordability that our businesses and individuals are faced with.
Do you think the system that you were envisioning before the election is less politically viable after the election?
Really what I want to do now, Paul, is talk, listen, and learn. And I've been talking to a lot of legislators from all parties. I've been talking to folks in the who are working in the healthcare system and the public. And I'm going to just spend the next weeks assessing.
Governor, does that mean that you don't know yet whether it's more or less politically viable?
Well, it's clear that on any issue that there was a very clear message to this governor: listen, learn, reflect, be more inclusive. It was humbling. So on every issue, I am taking that approach.
Specifically, though, on single payer, do you think that last week's vote was a rebuke of your ideas about single payer, or are you not able to?
I think it would be, I'll let the political pundits figure out what the election was about, but I feel very strongly, based on just what Vermonters said to me, there were a number of different reasons why Vermonters didn't check my box. And I think to suggest that there was one particular issue in terms of policy would be a mistake. There were lots of issues. I listened to the BPR show with Bob Kinzel last Friday. I think there was 6 or 7 different callers, all for different reasons. So I think we should be, I'll leave the punditry to the pundits, but I think we should listen to what's being said.
We did such a bang-up job on the election, so.
Right.
Can I ask you a question, sir? What do you think the constitutional intent of the vote before the legislature is? In other words, how do you read the Constitution on the fresh vote before the legislature? What was the intent, do you think, of the constitutional provision?
I'm not going to speculate too much on the intent, because if you read the words, we could probably all interpret a slightly different intent. All I can tell you is practice. And the practice has been since sometime in the 1800s, with one exception that's been well documented in the last few weeks, or last week in the press, John Alden. The precedent has been in Vermont that the person who gets the most votes in a democracy wins, and that's what the legislature supports. I'll be candid with you, as I have said before, democracy matters. I think Vermonters have a very deep commitment to fairness, and they have always communicated to elected officials from all parties, we do believe that the person that gets the most votes in an election should serve us, and that's what we've always upheld. So when I was at the other end of that, ran for lieutenant governor with Anthony Polina, Brian Doobie, and Peter Shumlin. Brian Doobie came in first, I came in second, Anthony came in third. Both Anthony and I said, legislature, please elect the person who got the most votes. I know that other candidates have done that in the past too. So, listen, the person who gets the most votes in democracy is the one that should serve that term, serve Vermonters. That's been a tradition, and I would be surprised if that tradition is not upheld.
Governor, with withholding revenue down, are you planning for your January budget addresses if there won't be a rebound
In other words, are you doing worst-case planning at this point for that budget address?
Yeah, I mean, let's talk a little bit about the revenues and where we are. In Vermont, as has happened in a lot of states across the country, there was a feeling that the recovery was going to be more robust than it's been. And it's clear now that Vermont needs to reevaluate going forward. I'm not just talking about next year, but for the next 5 or 10 years, as much as economists can tell us, that we're going to have a lower growth rate than the assumptions that were made over the last couple of years. We have a structural deficit at this point. In other words, we cannot expect rebounding revenues based upon what the economists are telling us to solve our problems for us. So as I go into this budget year, right now, I'm trying to do two things. The first is, in light of the disappointing revenues that we got for the first 4 months of this year, what do I do to make any adjustments, further adjustments, the ones that we made this summer, that would ensure that our budget's balanced, because that's my first responsibility for this year. Then going into 16 and building that budget, what do we do to correct the structural deficit that we're facing? It's going to be a lot of tough choices. You know the number is going to be somewhere around $100 million that we're facing. And I'm going to be putting together a budget, bringing in legislators and others to help us to try and figure out how we really solve this so that we're not back here year after year facing this challenge. It's not going to be easy.
So are you looking at potentially a 5% cut, another rescission, or level funding in the future? What's on the table?
Well, both. I'm trying to figure out whether I need to implement a rescission now in light of the October revenues, and particularly the disappointing income tax results. And two, I'm trying to write a budget in collaboration with folks, I hope, that will put Vermont on a sustainable spending path so that we're not every year back here saying, wow, we've got a 60, 70, 80, $100 million problem. So both have to happen.
Is there a cutoff line where it doesn't make sense to do a rescission now and just wait till the budget adjustment?
I'm trying to figure that out. My fear is that every month that passes makes it more difficult. We're 4 months into the fiscal year. If you try to do this 6 months into the fiscal year, it's just that much harder. I have the statutory authority to, my Secretary of Administration does, to make it 1% rescission. And obviously I'm looking at that very closely. If I had the answer, I'd tell you I'm just not there yet.
Governor, at the Vermont Health Connect roundtable later today, are you hoping that this shutdown will prevent any future shutdowns or glitches from happening, and this can be the last major issue? And also moving forward, how do you project spending on continuing to improve and fix the website?
So I really am, I'm always hoping that the website's going to work as it's designed to do. And as you know, we have a new vendor. I have some hope in the fact that Optum is the company that came in and fixed Massachusetts when they were in this problems, that actually fixed the federal exchange when they were in trouble, and a lot of other states. So I think we went to the right vendor. As I've said before, I've been disappointed enough times that I want to be very careful not to overpromise. But the answer is, I am hopeful that we're getting it right. We're going to bring it up Saturday. We think it's going to work. And, I'm not going to overpromise. I'm really hopeful that we're getting it right.
And in terms of the issue of money and what we're spending on the website, do you think this will be the last? I mean, I know it's with the contractor.
So let me lay out sort of what we're thinking. Sure. And frankly, Lawrence Miller can really get in the weeds with you at 2 o'clock today. But the whole focus has been to get this website ready for open enrollment, because we've got a lot of folks that are coming on. What we need to know about this open enrollment is, if you have no changes, you don't need to do anything. In other words, if your circumstances haven't changed, if there's been no change in your marital status or whatever it might be, just sit tight. You will continue to have the coverage you had under the policy you have right now. So the goal is to get anyone who has changes in circumstances or wants to sign up that hasn't signed up in and obviously insured. The second piece is, we then want to get the change of circumstance to work eventually through technology. That's something that very few people have accomplished to do yet. They're building these websites. I wouldn't say none have, but most people are not actually doing that electronically. We want to be one of the states that can, And our goal for getting that done is April, mid-April. So that's what we're trying to pull together, that's sort of the big picture. When we have those two things done, the website would finally be where we wanted it to be.
And the contract that the state has with Optum, that should cover fixing all of those issues.
I asked Lawrence about exactly, there are many different pieces to the contracting, so I don't want to give you an answer that isn't accurate.
Any plans for energy policy or personnel changes, Governor?
On personnel changes,